Hi, my name is Luke Schwartz. I am presenting on behalf of the Duke Tech Policy Lab in the Duke Cyber Policy Program. Today I'll be taking a deep dive into health data beyond HIPAA, one of the most interesting regulatory and ethical areas of tech policy today. To start off, picture this. You aren't feeling well and you want to decide if it's worth your time to go to the doctor. You take an online survey, reporting your symptoms to determine the best course of action. You get your answer and everything seems standard. However, before you know it, your health data has been shared with third-party companies without your consent or knowledge. Sound far-fetched? Think again. We are often reminded about the importance of protecting personal health information online, but when it comes to health data, it's a whole different ballgame. As with many areas within tech policy, innovation in the uses of health data is rapidly outpacing regulation. Current regulatory frameworks regarding security and privacy for health data are significantly falling short of where they ought to be, which poses critical challenges for patients. Today, we are going to look at some surprising cases where health data was used in ways that fall outside of traditional privacy laws. To understand why this is such a critical problem, you must have a general understanding of the core health data privacy law in the United States, the Health Insurance Portability and Accountability Act, more commonly known as HIPAA. HIPAA was a federal law passed in 1996, at the dawn of the Internet age. HIPAA sets rules and standards to protect the privacy and security of patients' personal health information. Notably, HIPAA is nearly 3 decades old. In fact, HIPAA was signed into law the same year the DVD was invented. Since then, there has been rapid growth and innovation in the collection and uses of health data. This presentation will seek to answer if HIPAA is sufficiently equipped to keep pace with the digitized healthcare experience and all the new ways that health data is collected. To gain a clearer picture of the situation, let's dig a little deeper into HIPAA itself. A major reason behind HIPAA's limitations is that it only applies to certain covered entities. The first type of covered entity is healthcare providers, which includes, for example, doctors, clinics, and pharmacies. These are the main actors in what most of us associate with the health sector. The next type of covered entities is health plans, which includes health insurance companies, health maintenance organizations, also known as HMOs, and government programs such as Medicare, Medicaid, and veteran health programs. The third and final type of covered entity is known as healthcare clearinghouses. A healthcare clearinghouse is any public or private entity that facilitates the processing of non-standard data elements of health information into standard data elements. Clearinghouses include companies like Change Healthcare, Violating, and Ziramed. As we will discuss later in detail, there are many categories of companies that collect vast amounts of identifiable health data that aren't considered covered under HIPAA. Thus, in many cases, health data companies fall into gray areas of the law. Notably, non-covered HIPAA entities do not have to follow the HIPAA privacy or security rules, which both play significant roles in protecting patient data. Let's look into the privacy and security rules themselves. Just as it sounds, the HIPAA privacy rule is crucial to protecting the privacy of patient-sensitive health information. According to the CDC, the goal of the privacy rule is to ensure individuals' health information is properly protected while allowing the flow of health information needed to provide and promote high-quality healthcare. Notably, it establishes a floor of privacy protections. States can impose their own privacy laws, which 5 states have done. We will touch on state privacy laws a bit later in the presentation. The privacy rule establishes guidelines that limit the use and disclosure of personal health information, commonly known as PHI, without patient authorization. It also gives patients several rights over their PHI, including the right to access, request, and amend their medical records. The privacy rule empowers patients while also providing guardrails on who can access identifiable health information. Now, let's briefly look into the HIPAA security rule. As outlined by the U.S. Department of Health and Human Services, the HIPAA security rule requires appropriate administrative, physical, technical, and organizational safeguards to ensure the confidentiality, integrity, and security of electronic protected health information. The security rule emphasizes the importance of confidentiality, integrity, and the availability of information. It exists to ensure that health data does not end up in unauthorized hands. The privacy and security rules actually do a really good job of protecting user data. However, the rules don't apply to everyone. Despite HIPAA being one of the most important pieces of legislation governing health data, there are many misconceptions about what is actually covered by HIPAA. Many people think that HIPAA protects all forms of health data. However, I regret to inform you that this is far from the truth, as HIPAA only protects health data in the hands of HIPAA-covered entities. As we witness continual advancements in healthcare, we find ourselves in a situation where critical health data is being generated beyond the purview of any data privacy law in the United States. This presents significant challenges in ensuring the privacy and security of sensitive health information. The next section of this presentation will explore the different types of health data generated beyond HIPAA. The first example is intermediary telehealth companies. Not all, but many telehealth companies operate as intermediaries between patients and providers. Thus, they fall outside the typical reach of HIPAA. Intermediary health companies can collect and share data without user knowledge or consent. This becomes especially pertinent and problematic in many of the telehealth startups that emerged and grew rapidly during the pandemic. A later case study will focus on telehealth companies that fall outside the reach of HIPAA and their negative implications for the security and privacy of PHI. The next major example is wearable health technologies, such as an Apple Watch or a Fitbit. According to a survey conducted by Statista, 45% of Americans wear a smartwatch on a regular basis. They collect wide-ranging data, including heart rate, physical activity, sleep, water intake, and many others. There is no strong regulation in the U.S. about how all this data ought to be collected and stored to protect the privacy and security of users' data. The next example is social media. In a world where data is so important, we become accustomed to sharing our lives online. However, sometimes people forget to stop and think about what happens to the data once it is out there. Imagine being denied health insurance because of something you posted about your health online. Sounds crazy, right? Well, not when your health data is out there for everyone to see. Social media is quickly growing as a place people go to discuss and share health-related experiences. People also share their symptoms, reviews of treatments, and health-related pictures and videos online. Many opt to willingly share this data with the world. The data is not protected by any sort of regulation and is easily collected by social media giants and is easily accessible by advertisers. Another entity that collects sensitive health information and not covered by HIPAA is genetic testing companies such as 23andMe and Ancestry. This is especially alarming as they are collecting DNA samples, which tell almost everything about an individual's health. Interestingly to note, there has been a drastic growth in the valuation of these companies based on the demographic and genetic data they collect, which demonstrates the rapidly climbing value of personal health data. Next, we have private disease and treatment registries. These are considered to be one of the best examples that operate at the intersection of protected and non-protected entities. They collect data about patients and are extremely well intended. They cover a wide range of diseases and conditions, including rare diseases, chronic diseases, and infectious diseases. Some examples of private disease and treatment registries include the Cystic Fibrosis Foundation Patient Registry and the National Multiple Sclerosis Society's MS Registry. But since regulation is lacking, sometimes their privacy and security standards fall short. Here's a great paper by Professor Leslie Francis from the University of Utah's Quinney School of Law. It discusses private registries and how they often fail to get the necessary data sharing and use agreements signed by patients. Consent is an essential part of health data collection and use as it maintains patient autonomy. This paper specifically focuses on the issue when children become adults. Definitely worth the read to gain a better understanding of how private registries operate. While this paper was published back in 2015, its core messages still are not fully solved today. Next, we have gyms and personal trainers. When a person goes to a personal trainer, they seldom think about the privacy and security of the data collected. However, this information can offer valuable insights into the person's overall health. The same applies to popular fitness and weight loss apps that many use as digital tools to support their exercise routines. None of this data is protected by HIPAA. Next, we have Femtech. Femtech is a term applied to software, diagnostics, products, and services that use technology to focus on women's health. There are many companies whose logos are displayed on the screen, such as Clue, Flow, and Ovia Fertility that provide these services. Information collected on these apps is not protected by HIPAA, which can have major consequences, especially in a world after Roe. And this will be discussed in more detail later in the presentation. Overall, it is abundantly clear that there is a lot of health data generated and collected that falls outside the scope of most existing data privacy legislation in the United States. To account for all of this data, the National Committee on Vital and Health Statistics began their Beyond HIPAA initiative in 2019. As indicated on the slide, this report examined emerging health information's privacy and security challenges that are beyond the scope of HIPAA law and its regulations. It also advocated for a health data privacy and security framework compatible with the 21st century. This report might have been premature, as it never could have envisioned or predicted the massive uptick in patient-generated data and telehealth services that became the crux of healthcare during the COVID-19 pandemic. A major aspect of this report is seeking to improve security and privacy frameworks, including privacy and security by design approaches that allows patients to sufficiently trust entities to safely handle their data. This is especially pertinent in emerging technologies. It's complicated because you want young companies to innovate in the health sector, but the problem is that young companies typically do not have the resources necessary to put strong privacy and security safeguards in place. This could require some form of government intervention to allow young products and companies to flourish in a patient-centric manner. Next, I'm going to explore one of the most fascinating use cases that combines health data sharing, privacy, security, and health data beyond HIPAA. I'm going to be referring to it as the pixel problem. So, what is a pixel? A pixel is a small piece of code offered by Meta that companies can place on their websites to track all traffic on their sites. They are particularly beneficial for a small company or e-commerce website to track website visitors' viewing and buying patterns. Some examples of data collected by a Meta pixel include page views, product views, adding to cart, starting checkout, and purchases. A pixel can be used to enhance the user experience and increase sales for the company. They also can benefit all parties involved if used correctly. However, an important caveat about using Meta pixels is that the information collected is sent directly back to Meta. It gives Meta access to unfathomable amounts of information that can be used for advertising to enhance Meta's own platform. As such, pixels can be extremely dangerous if not used responsibly or in the right context. They pose high privacy and security risks due to the high amount of data collected and sent back to Meta. In the US, this frequently happens without a user's knowledge or consent. One of the worst possible use cases of pixels is tracking traffic on hospitals' websites. Meta gaining access to PHI is obviously far more extreme than shopping history. Hospitals' websites have extremely sensitive patient information as they collect obscure amounts of highly sensitive HIPAA-protected patient data. A June 2022 investigative report written by Todd Feathers, Simon Fondry-Tietler, Angie Waller, and Surya Matu, published in conjunction between the markup and stat, found that Meta pixels had been installed on many hospital websites and patients' health information was being sent back to Facebook without patients' knowledge. This is a major violation of patient trust and autonomy. The report also found that Facebook received specifically sensitive health information, including illnesses, medical conditions, prescriptions, doctor's appointments, and procedures from hospitals' websites. Facebook was sent a packet of data every time a person clicked on a button to schedule a doctor's appointment. The data was collected and sent to Facebook even if the patient didn't have a Facebook account. This wasn't just something that happened a few times in a few hospitals. It was actually a very large-scale problem. In fact, out of the 100 biggest hospitals in America, 1/3 of them had Meta pixels installed on their sites. In 2020 alone, 26 million patient records were sent to Meta. This number was likely much higher, as this report only studied the 100 largest hospitals out of the 7,335 total hospitals in the US. The true amount of patient records sent back to Meta could potentially be multitudes higher than this report indicates. Among the 33 hospitals with pixels installed, one was found to have sent children's health data back to Facebook, violating many laws and raising high scrutiny. As if the situation couldn't get worse, 7 of the 33 hospitals installed pixels inside of patients' password-protected health portals. This would have given Meta access to all of patients' password-protected health information. This is extremely startling and raises many questions of trust within the US healthcare system. These were the 7 companies that the report found had pixels installed inside of patient portals. Notably, 5 out of 7 did not respond when given the opportunity to explain and defend their actions. The privacy and data security concerns surrounding hospitals is a serious issue that must be addressed. Patients trust hospitals with their sensitive data every day, especially during vulnerable times. Unfortunately, it seems that hospitals are not taking adequate steps to protect this information. Facebook claims that it does not use the data for advertising purposes, but critics argue that the company's history of privacy violations could raise doubts about this claim. After this report came out, some hospitals removed Facebook's tracking code from their websites, while others did not, even after being contacted about this investigative report. As with most privacy issues in healthcare today, there are major implications in a post-Roe world. Using pixels, Meta can determine who has had an abortion, which can have significant consequences. To explore this issue further, I spoke with Professor Jolyn Dellinger. Professor Dellinger is a senior lecturing fellow at Duke Law School, the Stephen and Janet Baer Visiting Lecturer, and a Duke Keenan Institute for Ethics Senior Fellow. Professor Jolyn Dellinger is also an expert on data privacy and laws surrounding reproductive health care. This entire situation we have been discussing throughout the presentation raises the question, does hospitals use metapixels to collect patient data without users' knowledge or consent constitute a violation of HIPAA?
I think this was a question many people were discussing when the markups research came out. I think you have three different situations. I think you have pixels that are on hospital sites, generally speaking. I think you have pixels that are associated with these appointment requests and sending information back that specifically has information that pertains to somebody's request for an appointment and the reason why. And then you have the pixels that are inside patient portals. And I think inside patient portals certainly strikes me as a violation of HIPAA. I think that's protected health information inside a patient portal and should not be disclosed. And I think it's an absolute violation of trust of patients in the system.
So what should hospitals take away from this situation?
First of all, don't put pixels inside patient portals. I think that's just a basic takeaway. It's a bad practice, regardless of the legality, because there could be people who disagree of whether it's a HIPAA violation. It's absolutely a bad practice. And I think it subverts the expectations of patients. So that shouldn't be happening. And no pixels should be associated with any kind of intake forms, questionnaires, requests for appointments, nothing like that. But I think hospitals should take it upon themselves to make sure that they are not allowing that type of protected data to go outside of the bounds of their own system and take that responsibility for themselves. Don't rely on Meta or some other company to be doing content moderation of some kind to protect the patients of the hospital. Just don't send it. Don't send the data.
And so, and also, what about Meta?
I think Meta has a history, and in fact, I think it was the case here, that they require apps to tell their users, to tell consumers what information the app is sharing with Meta. And that's good. I mean, that should be a requirement. But I think but Facebook or Meta tends to kind of put that onus or burden on the app or the company that's using, for example, a software development kit for Facebook Analytics or Facebook Login. They're like, look, it's your responsibility. So they try to put that burden on the intermediary company, whether it's Flow Health or whether it's a hospital in this case, using a pixel. And I think, again, Facebook should take more responsibility and accountability for its own actions.
Thank you so much, Professor Dellinger. To attempt to remedy the situation, numerous class actions have been filed. Class actions surrounding Facebook's data collection on hospitals' websites has been tried, with mixed outcomes over the years. Notably, HIPAA does not have a private right of action, meaning that individuals cannot sue if they feel that their HIPAA-protected right has been violated. However, people can sue under state laws or laws surrounding deception, for reasons such as a company violating their own privacy policies. Winning class actions can be difficult, and some of the lawsuits have been dropped. However, others have led to some pretty massive settlements. Notably, in 2019, Mass General Brigham Hospital was sued for violating patients' privacy and its own privacy policies by installing metapixels and other tracking tools on its website. While they admitted no wrongdoing, they paid out an $18.4 million settlement to plaintiffs in the class action. More recently, after this investigative report was released, Advocate Aurora and WakeMed had class actions filed against them. These are for violations against the Electronic Communications Act, the Stored Communications Act, and HIPAA. Advocate Aurora said that 3 million patients' health data was exposed through websites tracking technologies. Similarly, WakeMed notified nearly 500,000 patients that their data had been exposed as well. Notably, the defendants are the hospitals themselves, not Meta. There are many other similar class actions, all in different stages in the legal process. It will be interesting to observe how they progress, and if their outcome has a tangible impact on how hospitals use pixels on their sites, and if Meta continues to allow pixels to be used on sites that collect sensitive types of data. On Facebook's side, they claim that they take regular action and have processes in place to ensure that they don't accidentally collect overly sensitive information. In a response to the investigative report, Meta spokesperson Dale Hogan claimed that Meta had a filtering system that removes potentially sensitive data before it can be stored in their ad system. However, the last report and update on the filtering system was published in February 2021, where it was shared that the system was not yet operating with complete accuracy. I was not able to locate an update on the status of the filtering system. Also, Meta's terms and conditions do direct users not to send sensitive data to the company, which is a good step in the right direction. However, most users do not take the time to fully read and understand this information. Other solutions are likely necessary. For example, Meta should have processes in place to ensure that they are not in a position to accidentally collect this type of data in the first place. Taking a look back at the hospitals, most seem to claim that they had trusted Meta's pixels because they believed the technology had been sufficiently vetted. To further issues, hospitals probably did not have the right people internally reviewing their relationships and data flows with the data analytics partners. Given the information available, it is extremely difficult to tell how much hospitals knew about how their patients' data was shared. While most hospitals would likely concede that they place too much trust in Meta, I'm guessing that most would deny that they were aware to the full extent of who had access to sensitive patient data. Next, I will cover another related use case of pixels sharing sensitive health data without patient consent. This example is fully rooted in direct-to-consumer healthcare. Direct-to-consumer healthcare saw a major rise during the pandemic. Most companies offering direct-to-consumer healthcare are telehealth companies, and specifically telehealth intermediaries. This means that they are technically not healthcare providers, and thus they fall outside the enforcement of HIPAA. Direct-to-consumer healthcare relies heavily on advertising, as that's the main way that patients find out about direct-to-consumer healthcare offerings in the first place. This can potentially be beneficial when it leads to people getting the medical assistance they need, but it might also lead to some people getting the wrong treatment. A popular example of direct-to-consumer healthcare that was widely used during the pandemic were online surveys. Another report, also done by Stat in the Markup, written by Todd Feathers, Katie Palmer, and Simon von Reitieler, explored the pixel problem in non-covered HIPAA entities. During the pandemic, use cases of the direct-to-consumer healthcare model became popular as a way to receive some form of care without leaving home. People often take online surveys to get help with more sensitive matters, such as mental health and substance abuse. These surveys help people determine if they need to seek further help. But little did they know that the results of their questionnaires were being sent directly to major tech companies using pixels among other major tracking technologies. This was found in some capacity in 49 out of 50 companies studied, so almost all of them. These individuals were then targeted with advertisements related to their sensitive health conditions. For example, some general questions that were asked on these surveys included questions like, are you in danger of harming yourself or others? And what's your current opioid and alcohol use? Since these companies fall outside of the confines of HIPAA, they have no legal obligation to protect people's answers to these rather sensitive questions. So, what incentives do young companies have to collect large amounts of patient data and share it in the first place? For the answer to this question, I spoke with Eva Galperin. Eva Galperin is the Director of Cybersecurity at the Electronic Frontier Foundation. She is lauded for her extensive work in protecting global privacy and security of individuals, particularly those from vulnerable groups. So Eva, why are young companies often failing to keep patient-sensitive health information private?
So one of the most common things that I see in people who are starting out new businesses is that you gather as much data about your users as you can possibly get. You keep it forever because you never know when you're going to need it. And in an emergency, when you need to raise funds, you may sell it to data brokers because data brokers are always interested in user data and you need to make an extra buck.
Eva brings up data brokers, which are companies that buy and sell user data on the open market. These are very active in health data outside of HIPAA and will be explored in more detail very soon in the presentation. So looking back at the case study, while the first investigative report focused on Meta specifically, essentially all big tech companies played a role in the situation. Google, Meta, TikTok, Bing, Snap, Twitter, LinkedIn, and Pinterest all had trackers present on the telehealth sites. Notably, Google's website tracking technology was used the most frequently out of any companies. Google had trackers present on 47 out of 50 sites. Meta followed close behind with trackers on 44 out of 50 sites. Out of the 50 telehealth sites that were examined in this report, 35 of them were discovered to have trackers that sent individually identifying information to at least one big tech company. This information includes names, email addresses, and phone numbers. The report also found that trackers were placed on websites that gave fully identifiable information about addiction treatment and antidepressants to the big tech companies, which is obviously sensitive information that patients would not want on the open market. While the unauthorized sharing of data is bad in its own right, the deception that occurred was likely worse. At least 12 of the 49 sites with trackers installed falsely claimed that they were HIPAA compliant, and many even proudly displayed HIPAA compliant badges, when they were in fact nowhere near HIPAA compliant. So not only were these patients taken advantage of for monetary gain through their sensitive data, but in many instances they were straight up lied to. Privacy policies are oftentimes made unnecessarily confusing, which makes it almost impossible for the average person to understand what is happening with their data. We've established that health data is highly valuable, and unfortunately, it often ends up in the wrong hands. Data brokers are the types of entities who buy and sell this data. I will next explore another example of health data collected outside of HIPAA and what it means for Americans' highly sensitive mental health data. In February 2023, Duke Tech Policy Lab researcher Joanne Kim explored data brokers and how they hold a large amount of highly specific data on Americans' mental health. To explore this issue and report more in depth, I will be chatting with Justin Sherman. Sherman is the lead on Duke's data brokerage research project and the founder and CEO of Global Cyber Strategies. So Justin, can you first tell me at a high level what a data broker is and how they operate?
Data brokers are companies that are in the business of collecting and inferring and aggregating and then selling Americans' data. And so this is an ecosystem that hasn't received a lot of attention in the media and in the public eye when it comes to privacy as much as maybe Facebook or Google, and rightfully so for those companies to be scrutinized. But this is a multi-billion-dollar industry in the United States. There are thousands of companies who make this their entire business model. They do everything from aggregate lists of consumers to be marketed for specific products, like 20 to 30-year-olds who like coffee on the weekends kind of thing, all the way to companies that collect much more sensitive and invasive data, including health data, location data, and other kinds of information that's similarly aggregated and packaged for targeting and then sold to buyers on this open market.
Interesting. Next, can you please explain the data brokers and the sale of Americans' mental health data report?
We published this report from our data broker team written by Joanne Kim, who was a Duke student who graduated last year and finished converting her very, very long thesis into this policy paper that we put out in February. But the short of it was she contacted a few dozen different data brokers asking them what kinds of information they might be able to sell on Americans with mental health conditions, whether that's people suffering from depression, people with anxiety, and so on and so forth. And so she contacted a number of these. She heard back from a subset of that, and then from a subset of that, a few of those companies said to her that she would be able to purchase this kind of data from them. And so that ranged from more aggregated data. So, for instance, how many people in a given zip code have depression. And so the data set might literally look like a zip code and a number, a zip code and a number. So the company has the underlying health data, but they're not actually providing that to the purchaser. All the way to data sets that Joanne found in the study that were individually identified, that were, according to the brokers, clearly linked to individuals, including people with anxiety, depression, bipolar disorder, trauma, as well as a bunch of other information, including race and age and other demographic data as well. So all told, a really disturbing report, and really just shows that a lot of information most Americans assume is protected under federal law is not in fact protected and is being sloshed around somewhere and put into data sets and then sold on the open market.
What can individuals do to better protect their health data, knowing that this is happening behind the scenes?
The unfortunate answer is not that much. So there are a couple of states that have passed state privacy laws, including California and Virginia and Colorado and Utah and so on. And in these states, under these privacy laws, you can, in some cases, submit a do not sell my data request to certain types of companies. I keep saying things like certain, and in some cases, because there are a lot of exceptions to that, it is pretty narrowly scoped. And in some states, in California, if you file that, they don't even have to tell you that they received your request, which is kind of a bizarre thing to me. But so in some states, there are a few minor things individuals can do. It's also possible for people to pay for these data deletion services. So you pay a subscription fee, and they'll try to take your information down from people search websites or these white pages, background check websites that pop up online. But even that's not perfect. So all to say, there are a few of these things individuals can do. But when we're talking about a multi-billion-dollar industry of companies engaged in this activity who have evaded regulation for decades and decades, it's putting the burden, a completely unreasonable burden, on the consumer to do something. This is really something that policymakers at the federal level need to regulate.
So what are some of the best approaches that Congress can take to help mitigate this problem?
I would at least point out two things. The first is that HIPAA is almost 30 years old now. So it was almost 3 decades ago, right, that both Democrats and Republicans agreed that health data on Americans is extremely sensitive, it's extremely intimate, it's highly susceptible to abuse. And that was and remains a bipartisan issue that we need to protect health privacy. I think we just need to update HIPAA for the modern age is the way to think of it, right? We have, for instance, if a hospital makes an app to make appointments, that's covered under HIPAA because they're a business associate of a covered entity. But if I go tomorrow, set up an LLC, I live here in DC, right, and go make some mental health app and do all kinds of stuff with the data, I'm not going to be covered by HIPAA if I don't have any of those relationships. And so we need to broaden the scope of those controls, which again is something I think both parties are supportive of and came up again. I testified last week to the House and was of interest there as well. The second thing I'll say is when we talk about data brokers, conventionally to many policymakers, they think of a third party. So a company that you don't directly interact with as a consumer. That, I think, is an outdated notion of data brokers, because particularly in the health data space, I know you've worked a lot on, and others at Duke have worked a lot on, so much of that data comes from first parties. It comes from, for example, mental health apps not covered by HIPAA that sell data on their own users. It comes from non-HIPAA covered companies like GoodRx that the FTC recently took action against that gave away millions of Americans' prescription information to third parties. So I would say, don't just think about third parties, think about actually prohibiting first parties from selling health data. Because again, I think most people's assumption is that HIPAA covers this app. If I'm making an appointment for a therapist online or whatever, or I'm meditating even, they might not think of that as health data. All of that needs to be put under the umbrella.
This is obviously a very serious issue that demonstrates the consequences of unregulated health data beyond HIPAA. As HIPAA doesn't apply in many cases, we will look into different elements of the regulatory environment that have some impact on health data in the United States outside of HIPAA. First are the actions of federal agencies, namely the Federal Trade Commission. Section 5 of the FTC Act prohibits unfair or deceptive acts or practices in or affecting commerce. It gives the FTC the authority to oversee and regulate issues of this nature. For example, if a company establishes a privacy policy and then doesn't follow it, that would constitute a deceptive trade practice under Article 5 of the FTC Act. Another example of when the FTC could intervene is in cases where a company falsely advertises themselves to be a HIPAA-covered entity. To better understand the FTC's role of regulating unlawful collection of patient health data, I will outline some notable enforcement decisions. To start, in March 2023, the FTC fined BetterHelp for deceiving users about their data privacy practices. BetterHelp told users time and time again that their data was safe. However, as part of BetterHelp's service, users take questionnaires about their health. The data was then collected by BetterHelp and then ultimately sold to big tech companies for advertising purposes. To make matters worse, users were charged $60 to $90 a week for this counseling service. In addition to paying a $7.8 million fine, the FTC required BetterHelp to do 4 things. First, obtain affirmative express consent before disclosing personal information to certain third parties for any purpose. Second, put in place a comprehensive privacy program that includes strong safeguards to protect consumer data. Third, direct third parties to delete the consumer health and other personal data that BetterHelp revealed to them. And fourth, limit how long it can retain personal and health information according to a data retention schedule. These are all generally good practices to follow when dealing with health data, whether the data is protected by HIPAA or not. The FTC has another law in their rulebook to assist in regulating health data beyond HIPAA, known as the Health Breach Notification Rule. This rule was recently utilized for the first time in the FTC's enforcement action against GoodRx for sharing sensitive health information with big tech companies without patients' knowledge or consent. Justin Sherman alluded to the GoodRx case earlier in the presentation. GoodRx operates a telemedicine platform and a mobile app that tracks prescription drug prices in the U.S. To discuss this issue further, I continued my conversation with Justin Sherman. So Justin, can you tell me a little more about the GoodRx case and the Health Breach Notification Rule?
GoodRx and the FTC is a really interesting case for everything we're talking about: health privacy, data brokers, the sharing of people's health information. What happened in that case is that the FTC is the one taking action because GoodRx, even though it is a telehealth company, it provides prescription drug discounts to millions of people, is not covered by HIPAA. If it was covered by HIPAA and it was violating HIPAA, then the Department of Health and Human Services, which is the HIPAA regulatory agency, would be acting. The reason it's the FTC is because GoodRx was doing a couple of things. The first is they had on their website that they were HIPAA covered. That is false. So maybe that's technically not a lie if there was not knowing intent or something, but that was patently false and they're not covered by HIPAA. And so a key part of the FTC's authority is to enforce against companies engaged in unfair or deceptive acts and practices. And so their argument was, well, first of all, if you're not even suggesting, you're just telling people that you're covered by all this privacy regulation and you're not, that's deceptive. And so that was the first piece. The second part of that is they actually put a HIPAA compliance seal on their website, which is not a thing. So that made it worse, and that was part of the same deceptiveness. But the second piece, as you referenced, comes back to this health breach notification rule, which basically requires certain entities handling health information to notify users about unauthorized disclosures of their information. And the FTC's argument with GoodRx is that you can't say to consumers that you're HIPAA covered when you're not, that you're HIPAA compliant when you're not covered, and that's not a thing, and then bury at the bottom of some million-page privacy policy that you might share data with third parties, and then consider that millions of people consenting to say, sure, share my prescription health information with Facebook and with Google and with these other companies. And so that really was the core of the action, was to say this is unfair, this is deceptive, and hence it was within the FTC's jurisdiction.
Here's another example of the FTC's action. In this instance, Weight Watchers was collecting children's health information without parental consent. This is especially critical as it took advantage of young children. This case was also significant because Weight Watchers had to entirely delete the data and the algorithms that they had developed from the children's unauthorized data collection. Here are some other recent important FTC enforcement actions. In August 2022, the FTC sued Kochava for collecting geolocation data without consent. This could be especially detrimental for tracking people going to reproductive health clinics. Secondly, 1 year before the Kochava case, Flo Health faced criticism for sharing fertility-related health data with big tech companies. Instances like these are unacceptable and a violation of patient trust. To discuss the Flo Health case and privacy in a post-Dobbs world and how it all ties back to metapixels, I continued my conversation with Professor Jolyn Dellinger. Professor Dellinger, tell me a little bit about the use of metapixels in a post-Roe world. What are their implications?
Post-Dobbs, that was June 2022. After that time, states quickly began criminalizing abortion. And when abortion is criminalized, women and providers and people who are helping women obtain reproductive health care are going to be surveilled. So that's how this comes into play with all of the things that you're talking about in this video. So we're talking about commercial collection of data, whether it's through something like Flo Health or Flo Health or a mental health app that could ultimately be used as evidence in an investigation or a prosecution of an abortion-related crime. So pixels, we talked about pixels earlier, and pixels on the sites of hospitals or inside patient portals could be one way that data related to abortions is being communicated, but it's not just pixels. There's also the use of software development kits or SDKs. That's what was happening with respect to Flo Health. And it was the way that events were coded that was causing very personally identifiable information to go back to Facebook in that case. There's also the outright disclosure or sale of data for advertising purposes, I think, which was at issue in BetterHelp, which you may have discussed, and coding of events there in that case too. There's also the involvement of data brokers and data brokers buying this information and then selling it on in lists or profiles. So all of this, collection of these different technologies or practices substantially compromise privacy and are putting women at risk in a post-Dobbs environment where abortion is criminalized.
Another way to regulate health data beyond HIPAA is state privacy laws that extend to data more generally. 6 states currently have privacy laws on the books that impact the collection of health data and some security standards surrounding it. One example is Washington State's My Health, My Data law, which was signed into law on April 27, 2023. This is the first state privacy law to focus on health data specifically. This law expands what is considered consumer health data to include the types of health data outside of HIPAA highlighted earlier in the presentation. The scope of consumer health data under the law is intentionally broad and solves many of the problems discussed throughout this presentation. Notably, this law gained traction and was eventually passed, partially in response to the overturning of Roe v. Wade. This law goes into effect in 2024, and it serves as a fantastic step to addressing the health data beyond HIPAA problem. But unfortunately, This law only covers a single U.S. state. There is still a very long way to go. On a much larger scale than state laws, the EU has one of the most robust and all-encompassing privacy laws in the world. The General Data Protection Regulation, also known as the GDPR, is a blanket privacy law that covers all sectors and has strict penalties for failing to comply. While some may argue that it stifles innovation, it strongly protects individuals' privacy and does not allow any data collection or sharing without user consent. This heavily juxtaposes the regulatory environment in the United States, which is a patchwork of federal laws, executive oversight, and state laws. Next, I will briefly explore some ways to implement strong security and privacy by design practices to protect health data. These are good general practices that help remain both legally and ethically compliant. To discuss the best security and privacy by design practices, I continued my conversation with Eva Galperin. So, it's easy to get security and privacy by design confused. What are the differences?
When we talk about security for companies, for applications, or just data security in general, we're talking about securing networks and devices and computers and platforms, trying to keep them from being compromised by sort of unwanted threat actors. Privacy, on the other hand, has to do with helping your users control their own data. And that includes keeping it private, possibly from you or from somebody who shows up at your company with a valid warrant or a subpoena for that information. Privacy is very much about protecting your end user rather than protecting your devices or network or company or platform.
What are some examples of privacy and security by design best practices?
One really great security by design practice that I recommend to everyone is that all of your logins should have two-factor authentication enabled by default, and you should use the strongest level of second factor that you can reasonably do or that your users are comfortable with. So an authenticator app is generally preferable to authenticating over text message, and a sort of a dongle such as a DuoKey or a YubiKey is even more secure, but is sometimes very difficult to convince your users to use, especially by default. But it is certainly the highest level of security. I also recommend that if you have any kind of messaging capability on your system, that all of your messages should be end-to-end encrypted by default, and that there should be some method of turning on disappearing messages for conversations. And finally, I would be very careful about the kind of location data that you're gathering. And part of that is because location data is not very strongly protected under most regulations in the United States right now. And that means that various types of threat actors could reasonably ask for these things using not even a warrant, but a subpoena, which is much easier to get than a warrant. And that's one of the reasons why you should just not collect any location data unless you absolutely have to. And you should only keep it for the minimum amount of time that you need to use it.
So, are there any privacy and security design best practices also required by any government policies?
There's not a lot of regulation or guidance from legislation around best practices for privacy or security by design. And part of that is because we're looking at a constantly shifting field, which is one of those areas in which regulation and legislation is sometimes moving too slowly and may not actually be helpful. But there are a lot of industry standards that are worth taking a look at. If, for example, you are concerned about security, I would start with something like the OWASP TAP 10.
Now that the problems plaguing health data beyond HIPAA are fully on the table, I will explore a few ways to solve these problems. A first proposal would be to increase the FTC's involvement in enforcing unfair and deceptive trade practices surrounding the collection and sharing of health data. As we've seen the FTC decisions over the past few years, the FTC has actually taken a bigger role in regulating the health data privacy space, and they are actually doing a pretty good job. However, it is widely agreed that the FTC is both underfunded and understaffed. It will require stronger government investment to ensure that the FTC has the staff and resources necessary to continue to oversee patient privacy violations. A second option is to redefine what is covered by HIPAA. As Justin Sherman mentioned earlier, this would require rethinking who is considered a HIPAA-covered entity, as this could impact what types of data can be lawfully shared. A third option could be to take a step back at the federal level and let state laws drive the privacy regulatory regime. As Washington State's new health data privacy law demonstrates, there's a lot of movement with states advancing privacy-focused legislation, so this approach would ensure this trend continues. However, this approach could create conflict when state laws clash. Fourthly, passing federal privacy legislation would be the most comprehensive option, as it would apply to all data collected and shared within the United States, including health data. While there has been a lot of talk about passing such a law for some time, there have been two major holdups. The first is whether the law should contain a private right of action, and the second is how preemption will work with other laws. Overcoming these hurdles would likely result in a federal privacy law being enacted. A final idea is mandating different types of privacy and security by design practices, like the ones Eva Galperin discussed. This will ensure there are more extensive safeguards protecting patient data. It's been a pleasure giving this presentation. While these issues are startling, there is a lot of room for great people to get involved and help address these problems. If you have any questions or want to discuss the content of this presentation in more detail, please reach out to me at luke.schwartz37@gmail.com. Thanks for your time and attention.